first Zoom webinar events presented by the World Affairs Council of Orange County. My name is Rick Putnam. I'm a Programs Committee member and Council trustee, and will be your facilitator today. And before we start, I just want to give a big shout out and thank you to our staff who put this together. This is the first run for one of these programs as we all are sheltering out from home. So thank you to them, and thank you for us. Thank you to Harley for joining us today. So with that, I'm honored to introduce to you our Orange County's 48th Congressional Congressman, Harley Rouda, Representative Harley Rouda, as our speaker and guest today. And as a very timely topic, he'll be starting off and giving us his perspective on the pandemic from both a global, national, and Washington, D.C. based, as well as a local perspective, and as well the policy impacts that we've seen out there. Please feel free to shoot us questions using the little chat bar at the bottom of your screen. If you're using the Zoom app, you'll see that as a little orange square at the bottom of your screen. And if you send a question along, I'll sift through those as we receive them and get those to Harley. So with that, Harley, please take it away.
Hey, thanks, Rick. And I can't help but think it was one day before I was supposed to be with you in person when things got shut down. And this was one of the very last appointments to get canceled. And here we are rescheduled on Zoom. And just 6 weeks ago, society frowned upon the idea of spending long periods of time in video chat rooms with adults you don't know, but here we are. And that's the reality of today's situation that we're in. Rick, thanks to you and Evelyn, who are dear friends of my wife, Kara, and I, and for your leadership with putting this program on. And I've been to some of the programs in person. You guys, the organization just does a great job and plays such an important role in keeping Orange County residents informed as to world affairs. So let me talk a little bit about COVID-19, about the federal response to date, what still needs to be done. Then I'll probably talk a little bit about my perspective on what we need to be doing, and then I'll open it up for questions. And one of the things too that I would welcome any input that any of you have is, I'm going back to DC hopefully next week, but it may be the following week, but we are actively working from a distance on legislation, both fixes to existing legislation as well as new legislation. And if you have ideas that you want to provide me or ask me about on the call today, that's fine, please do. I welcome the input. So when we look at where we are right now from a federal standpoint, we've passed 4 major pieces of legislation. The biggest piece was the CARES Act. That was the $2.2 trillion relief package that really fell into 3 primary buckets. One bucket was approximately $500 billion for what you might call too big to fail type industries and businesses. Then you also had another significant bucket for specifically outlined for the hospital system that was being crushed, or the anticipation that they could be overwhelmed with the increasing infectious rate across the United States. And then the third area was trying to address jobs and small businesses. And that really fell into 2 additional buckets. One was the PPP, the Paycheck Protection Program. And then the second piece, the unemployment insurance, where the federal government was providing $600 per week on top of state benefits across the country for a set period of time. And shortly after that act, we saw that the PPP program, and we knew it was underfunded, at least in my opinion, the first time around. So we replenished it with some additional money for some other areas. But again, it's going to be underfunded again. We're going to have to go back and figure out how to continue to support those small businesses. In addition, right now we're working on new legislation, and that falls into 2 different areas. One is what I'd call the major plugs that need to be fixed from what we have already passed. And I would say the biggest one there, excuse me, let me fix my light. I'd say the biggest one there is, and you're seeing it in the news, it's a negotiation right now going on about extending relief to cities and states, primarily cities. The challenge we have with the cities is that cities across the country right now have experienced a double hit. The demand by their residents on city services is hitting an all-time high. Simultaneously, their tax revenue has been decimated by businesses being shut down. So we recognize that if we don't do something, we are going to have cities filing for bankruptcy across the United States. That's, in my opinion, something that will just simply cause us to go into an even deeper depression and extend it out. So I'm hoping to work with the brethren in Congress on both sides of the aisle to find some relief for cities and states so we can avoid that outcome. The other part is a lot of technical fixes. You can't pass a $2.2 trillion piece of legislation in a matter of weeks, replenish it with another $500 billion without having technical issues crop up. And I can cite quite a few, but just to give you a couple examples. One, when it comes to the Paycheck Protection Program, I think everybody on this call probably recognizes how it works, but a lot of the FAQs and regulations that have been promulgated since then are not alleviating the confusion or addressing the original intent of that legislation. So case in point, it doesn't help a bar in California to get a PPP program and hire back a bunch of employees who aren't allowed to work, right? They are shut down from even keeping their doors open. So I think we need to make some technical fixes that allows them to still get the PPP loan that could become forgivable, but have the dates it applies to those businesses correspond with the dates they're actually able to open for business. On the healthcare side, we, in anticipation of surging needs in our hospitals and our frontline healthcare workers being needed, the last thing you want when you have a surge on your hospitals is having your healthcare worker getting infected and not being able to do their mission. And that's exactly what's happening. We're seeing it happen in any hotspots around the country. They're on the front lines, they're higher propensity for infection. That infection happens, they're out of the workforce. So we have worked to try and attract recently retired healthcare workers to be able to come back and help out, not on the front lines, but more on the back lines that allows more people that aren't in vulnerable groups, such as 65 and older, to be able to continue to help those that have been infected. The problem is, if you're 65 years old and on Social Security, you can't come back and work without jeopardizing your Social Security benefits. So we've got to change that for the time being so that they can help address the pandemic. And that's just two of many examples where we have technical fixes that need to take place for us to be able to achieve our outcomes here. Next thing I'll talk about is my take on where we are in addressing COVID-19 in a pandemic on a national basis. From a macro standpoint, I think the administration has done a poor job by abdicating responsibility in virtually every area of addressing the pandemic to the states. There was a playbook. It was handed to this administration by the previous administration, and it wasn't followed. And if the shelves were bare, as the president likes to repeatedly state, he's had 3 years to make sure that they were stocked and ready for the pandemic. And again, it's not a question of if, it's a question of when it was going to happen. It just happened to happen here in 2020. So we have lessons from this as to what we need to do. But if you hear the experts right now, I think we have to stay focused on facts and science. And I believe the discussion is drifting away from that baseline narrative. Specifically, most experts will tell you that this is going to continue to spread across the United States. That 60 to 70% of United States residents will get COVID-19 within the next 24 months. the original purpose of flattening the curve, so our healthcare facilities and healthcare workers would not be overwhelmed. They were overwhelmed. We've seen it in some in Detroit, in New Jersey, and to a lesser extent, New Orleans. But generally speaking, we have flattened the curve. And that's allows us to make sure that our healthcare facilities are not overwhelmed, but we still need to continue to protect those that are vulnerable. Obviously, the 65 and older cohort, those in nursing homes, those with underlying medical issues are all at a higher risk than the rest of us. But we can't define the discussion as staying shut down or removing all restrictions. We have to look at this pragmatically, that it's a combination of both and somewhere in the middle. We have to recognize that what we do has to be contingent on what the evidence and the facts are telling us in that area. California, case in point. I don't think one size fits all should be the program here in California. LA County should still be in a lockdown type situation, doing everything they can to suppress the transmission of this disease. The numbers bear that comment out. However, we have counties in California that have 0 deaths and nominal infections of the disease. They need to be, in my opinion, treated differently. We can't have one size fits all, whether it's a state the size of California or the country as a whole. As we continue to make sure that we flatten the curve, allow new therapies to be developed, allow us to protect our vulnerable communities, but also allow economic activity to continue to return while managing that process, all in the hopes of getting to a vaccine at some point. And let's be clear here too. Even though we have lots of rosy news about a vaccine that's going to occur at some point, there's also discussion that it may not happen. COVID-19 is coronavirus. So is the common cold. No one has found a vaccine for the common cold yet. And even the flu, we find vaccines for it that have to be modified every single year as the viruses mutate. So we're clearly going to have to deal with that possible outcome as well as we move forward. So Rick, with that, I'll pause, and you are more than welcome to ask me any questions you would like.
Thank you, Harley. Can everyone hear me? Can you hear
Yes.
me? Thank you. That's a great summary. And why don't we start with a couple of questions that I've received that are more local oriented and just regarding policies locally. Bring us up to speed on and I'm going to keep this sort of there's been some partisan questions a little bit, but I'm going to keep away from that and just really address topics such as the following in this manner. Where does Orange County stand right now with respect to opening of schools and beaches, and what do you think are the best policies to follow as we move towards that?
Yeah, on the beaches, we'll start there. The beaches were open to some degree all along, and the governor took an action to close down the beaches in Orange County, which we had conversations with the governor's office that we felt that the concern for the health and safety of residents is important, but we have to look at the reality of what was going on. And the reality of what was going on is that if you look at the pictures of the beaches being overcrowded on a heat wave weekend, you can get that sense when you take a photo straight down the beach. The overhead aerial shots showed, generally speaking, there was good physical distancing. Not always, there's always exceptions, but generally speaking, it was good. The real problem occurred in the egress and ingress to the beach. Many of these local communities were overwhelmed with beachgoers because both LA County and San Diego County, in anticipation of the heat wave, closed down their beaches and made no access available. Orange County being open and closing the parking lots next to the beaches caused residents here in our county, as well as those that came in from LA and San Diego County and elsewhere, to park in the neighboring communities. causing a lot of consternation for our neighbors. And clearly, walking in large masses up and down the sidewalks as they went to the beach. To me, that's where the real issue was. The real issue was not having a well thought out plan as we as decisions were made to keep the beaches open during a heat wave when surrounding counties were closed, and also not having proper ingress and egress. So we're past that now. The governor ordered the beaches, all public beaches in Orange County, closed on Thursday. And we worked around the clock with the governor's office and the local municipalities to get that reversed. We felt that some of the municipalities had plans that allowed their beaches to be opened in a way that provided appropriate social distancing, physical distancing, while protecting residents' health. Laguna Beach and Seal Beach, two that had really good plans in place and ready to go. Since we started working with the governor's office, all beaches have been approved by the governor's office, with the exception of the county beaches. We're still working on getting those approved as well, but all the city beaches are now approved.
Great, thank you. And a comment about schools reopening, and especially perhaps any testing procedures being considered for teachers, staff versus kids.
Well, we're not even close to being able to have adequate testing here in Orange County or anywhere in the country right now to the degree that the health experts are suggesting we need. So, as far as the schools opening, we do have to rely on healthcare experts as to what is the safe way to be able to do that, so that I think everybody knows, generally speaking, those under 18 have an incredibly low mortality rate and are often asymptomatic if they contract COVID-19, but they're quite capable of spreading it. And so we have to be concerned about the teachers and the staff that go to these schools, as well as what is taken home to the respective homes. This disease travels initially inter-family and then intra-family. So as non-family members interact and spread the disease, they bring it back to their families at home. And that's obviously something we'd like to avoid, especially if members in the intra-family are in one of these vulnerable groups, such as 65 and older.
Right. Tell us a little bit about your comment on vaccines and the potential for for those or a vaccine to come into play at some point in the future. One questioner has indicated that there's up to 14 different vaccines under trial right now.
Right.
And perhaps a comment as well as to what country or international partners have helped us the most in that effort.
Yes, there's 14, I think that is the correct number, that are under trial right now. The hope is, I should say, the process typically in situations such as this is that those 14 would then allow 2, 3, 4 that are truly promising vaccines to emerge. Not all 14 will emerge as promising vaccines. So as we narrow the field down to those that have real promise, what typically happens is you start continuing that trial, but then you start manufacturing. When you see that you have 2 home runs, 3 home runs, you start manufacturing those vaccines in large quantities, knowing that even 1 or 2 or 3 of those vaccines may end up going into the trash, but you don't know which one. So in preparation to have sufficient vaccines available, you manufacture all 2, 3, or 4, so that when you do have defined, documented, evidence-based winners, then you're able to deploy that much faster because you have been building up a supply network for it. Now, that being said, there's 6 billion people around the country, around the world. And even if we have a vaccine as early or late summer, which is, borderline wishful thinking, not impossible, but really, on wishful thinking, think about the process of being able to get those vaccines ramped up for 330 million Americans and 6 billion people worldwide. So it's going to take a while before even once we have a successful vaccine or vaccines, to be able to get that out around the world. And then to answer your question, what countries are we working best with? Unfortunately, that's not really the situation we have right now, because again, the administration has abdicated its role in that regard to some degree. But what we are seeing is U.S. businesses and international conglomerates working together and universities to support each other with fact-based evidence that can help accelerate good outcomes here, good outcomes being a successful vaccine.
And what is the prognosis for the pandemic globally? What have you heard regarding its spread? Does it peter out after a couple of years in the absence of a vaccine, or what is the sort of global spread curve look like over the next year or two, I suppose?
Well, let me say this first. Anything that any of us say, including me, on this topic is subject to change, because we have seen so much change already in just 2 months, the information that comes forward. So we have a new novel coronavirus. And the word novel is important here, because while we can look at a coronavirus and how it has behaved in previous coronaviruses, you can make assumptions that should apply to the novel coronavirus, but it's not a guarantee. Because it is novel, it may have characteristics and behavior that we have not seen in previous coronaviruses. So that being said, many of the experts would suggest that in the future, we will no longer have just cold and flu season. We will have cold, flu, and COVID-19 season. And as it spreads across the globe and you get to that higher infection rates of 60 to 70% of all individuals, including Americans, you start to build herd immunity, antibodies in all of us that allow us to better take on the implications of being infected by COVID-19 or a future mutation of it. Just like the original common cold devastated the world's population at that time. However, we have all developed antibodies to it that while we are still affected by the cold season, it's not as lethal as it once was. Same thing is true with the flu. While the flu is still very lethal, and certain strains are more lethal, we have developed some antibodies because of our constant infliction of it over hundreds of years, thousands of years perhaps, and that serves us well. So we're at the very beginning of an infectious disease that may be with us forever after.
Got it. How about a little comment on the relief funds that have been put out there, the amount of debt that our country is taking on? How ultimately will this be paid for? I mean, I think we all realize that the Treasury is essentially just creating dollars at this point. But perhaps a comment on that and the mood in Washington regarding the debt and deficit that's growing, as well as your comment on do the states that are in financial trouble get bailed out? Do they get left to go bankrupt, or are they supported in some way? Otherwise, it's being considered.
Yeah, a lot of questions there. So let's start with the federal government's likelihood of continuing to provide funding and appropriations to address the pandemic and the economic depression that we are in. I think the answer is yes, but I think it's going to be that we're not going to have to rush into it as fast as we did previous legislation. That's in my opinion. We do need to continue to address the funding for small businesses through the PPP program. I'm also of the opinion that that program needs to be expanded. I mentioned earlier that we set aside $500 billion for too big to fail industries and companies. We underfunded small businesses. Unfortunately, a lot of businesses in the middle got left out completely. And guess what? Those jobs are just as important to our economy as jobs with a Fortune 500 company or a mom and pop store down the street. So we need to make sure that we have appropriate relief for all businesses that can get them through to the other side of this. That being said, I am incredibly concerned about the deficit. I was concerned about the deficit before the pandemic, and I'm even more so now. Rick, you and I have talked about this before. I ran for office, believing most Americans are between the 20s. We believe 20-yard lines. We believe in fiscal responsibility and social progress. And when it comes to fiscal responsibility, we have been anything but that as a country, with $23 trillion in debt. And obviously, we are adding more and more onto that. The 2017 tax cut, usually in the history of our government, tax cuts were done when you were in a recession to provide an incentive, a fiscal stimulus to get us out of the recession and get the economy back on track. It's one of the first times we've ever done one that big when the economy was already buzzing along. And to put in, and I like to give this statistic because we get lost in the numbers. That tax cut added $2 trillion to our overall deficit. What's $2 trillion mean to us? At a current 2% interest rate at the federal level, that's $40 billion a year in interest payments. 40 billion. But what's 40 billion buy you? It buys you a free college education for half the 18-year-olds in America to our public universities. So when you start thinking about the trade-offs between increasing debt and the interest on that increasing debt versus saying having the best educated workforce in the world, we have to come to terms that we cannot continue to live on this sugar high. And I actually have legislation that I'm proposing that'll be coming out in approximately the next 30 to 60 days to take on the federal deficit. The problem is with the Simpson-Bowles legislation, and to refresh everybody's memory, Simpson-Bowles was an independent group of part Democrat, part Republican, that had to agree on a plan of action to take on the federal deficit. And as you might suspect, it included a little of everything from raising taxes to cutting expenses to having incentives to increase growth and the tax base. And while everybody was all for it, it came out, and once it came out, everybody on both sides started nitpicking this, that, and so on, so that the legislation never went through. And that's what we need. We need to try this again, but have a quick up or down vote on the proposals of this independent commission. And hopefully by shortening the time frame of an up or down vote, we've got a better chance of getting it passed, because we are literally kicking the can down the road to dump this issue on our kids, our grandkids, and future generations.
Agree. And comment on the states in terms of bailout, bankruptcy support.
Yeah, look, we don't want our states going bankrupt either. And I don't know why McConnell brought this up. Again, it's politicizing a pandemic. We don't need to be doing that. California's got a huge surplus right now. And of course, we're going through that surplus damn quick because of the pandemic. But California isn't a state that is in dire straits because of too much debt. And I thought Governor Cuomo fought back correctly when he pointed out that New York is the biggest giver to the federal government in relationship to what it receives back, while Kentucky is one of the biggest takers of federal dollars versus what it pays in. California is a net giver as well. So, I don't think these conversations are actually very helpful, because it becomes a blue state, red state thing when this should really be an American issue. It's a pandemic. It's affecting all of us. Let's keep in mind, 70,000 Americans, our fellow Americans, whether they're New Yorkers, New Jerseyans, Michiganders, or Californians, they are dead because of this pandemic. And we should quit trying to politicize whether it's red state, blue state issues, and recognize that as 100 to 150,000 or more Americans die, we ought to be working together to figure out solutions.
Agree. Well said. And I think the majority of the folks on the call here would agree with that. More specifically, though, to Orange County, and as referenced by one listener, there are 27 different special districts across Orange County, such as water, wastewater, mosquito abatement, cemetery, parks and recs, et cetera. Many of those were not any part of the relief package and are certainly part of, county and state funding mechanisms, but still are without liquidity today, perhaps, and are certainly the services are suffering due to stay-at-home policies, et cetera. Is there any consideration being given to any of those entities in terms of relief in the next package or by the state?
Sure, that was my Marco Rubio moment there. I had to get a drink of water. The answer is hopefully. We don't hold me to this number, but I believe the federal government released $300 billion to the county for COVID-19 relief and assistance in addressing it. None of the cities in Orange County received any money because we don't have a single city in Orange County of 500,000 population or above. That was one of the other criteria for a city to get direct funding from the federal government. So we're working, I've proposed legislation and letters to address that because we think that's unfair, especially for the, I think we're the 5th most populous county in the country, and yet the county got funds, but no cities did. So we're trying to address that. In addition, for the money that has come in, the original language around it was that it had to be specifically in addressing COVID-19. And in the sense was it had to be very specific to healthcare issues surrounding COVID-19. We'd like to expand that so that counties and cities have more discretion in how that funding is used to address a more broader COVID-19 response, whether it is healthcare, obviously, but also just law enforcement is taking on a more expensive role in how they have to manage this process. We have increased expenses in trying to house the homeless in an efficient way to help reduce the likelihood of the spread of the disease, not just in the homeless population, but beyond. So there's a lot of expenses that you can say are the result of COVID-19, but not specific to treating somebody with COVID-19. And again, we're going to keep fighting to give our county and our cities here in the district, as well as other districts, more flexibility in using that federal relief package.
Got it. Thank you. How about a comment on the current lack of détente in terms of dialogue with Beijing that the Trump administration is currently conducting? I think a lot of us feel like there's some blame that should be acknowledged there, yet the conversation doesn't seem to be going very well. And as a part of that, can you comment on sort of the DC circle's opinion on the World Health Organization these days? The U.S. has been the largest contributor to that organization for decades, probably. But as it has retreated from such multilateral organizations, others have hijacked it a bit. But those two questions on the China relationship and who.
Yeah, so again, you're going to find me more in the middle here because there's always a little truth to both sides. Let's start with who first. The World Health Organization need to be held accountable. They do need to be held accountable for their management and mistakes in addressing what was an epidemic in China that has now become a global pandemic, and the failure to work with China and hold China accountable for real evidence and information, and helping other countries understand accordingly what actions need to be taken. They dropped the ball. There's no doubt about it. As far as this administration's response to it, I think the administration is right to call them out for the mistakes. I think it is right to call them out for being a little too chummy with China or taking China's word for what was going on when there was clearly evidence to the contrary, including evidence from United States intelligence that had also been delivered to the president. And but if we want to change the behavior of WHO, I think realigning how we work with them versus just saying we're pulling out is a better way to go. Just saying we're out and we're not going to fund it, or we're not going to provide volunteer funding anymore, actually has, in my opinion, the opposite effect. It drives them further away from any chance of working with us to address their internal issues, and pushes them further into, say, the China camp. I think we should be using that as leverage to get what we want. This is important that everybody understand. There's two buckets that the United States provides to WHO. One is formula-based that applies to all countries, and we pay that in. In addition, we provide voluntary funding above and beyond that is approved by Congress. So my hope is Congress will work with WHO that those voluntary funds have to be tied to appropriate changes in the administration and management of WHO. I think that's the right way to go here to get the outcomes we want. As far as our overall relations with China, yes, they continue to get worse. And we have a president who said China was doing a great job in dealing with the epidemic on one hand, even though he was getting intelligence reports to the opposite, to now they're horrible, they're responsible, and they're solely responsible. No one else is responsible for mismanagement of the spread of the pandemic. And I just don't think that's helpful right now. Again, there's going to be a time and a place to hold those accountable who failed to take action, whether it is WHO, whether it is China, or whether it's this administration. There will be a time and place for that. But right now, let's stay focused on saving American lives and getting our economy back up and running as quickly and as efficiently as possible without jeopardizing health risk in a way that defies common sense.
In that vein, what is the administration or Washington Congress doing to look beyond this, if it does have time right now, and maybe there's no focus at all on the next pandemic or the next sort of global catastrophe that might happen? Is there any planning going on for the future, the long term, to help the U.S. get through this sort of thing again? And then related to that, in terms of funding for the CDC, National Institute for Health, any debate there with respect to more robustly supporting those institutions if they deserve it?
Yeah, so George W. Bush, his administration recognized the need to start planning for the potential of a pandemic that could also be state-sponsored or simply occurring in a more normal fashion. And the Obama administration continued that and progressed further in developing comprehensive plans and funding for it. And the Obama administration, in the handoff to the Trump administration, did what every administration does. You have the respective agencies work with those who are coming in to understand what you have, what you've been working on, what are your concerns, what are the national security threats. That happened here as well. Unfortunately, you can make an argument that the administration did not take seriousness of a potential pandemic under notice. And further, the team that was primarily in charge of addressing the possible outcome of a pandemic was terminated when Bolton was there. I don't know if Bolton was just changing the leadership and it didn't get addressed because he was then let go himself and the agency was left bare, or whether that was part of the plan. I honestly don't know. I do know that it was a bad timing at best, and at worst, something different. As far as the CDC funding goes, the Trump administration, every single budget since he has come into the office, they've tried to cut the CDC budget, and Congress says no. In fact, we've increased it. But I think one thing we've learned from this pandemic is that CDC plays a very important role in trying to keep us safe. Cutting their budget's probably not the smart thing to do in a global economy where people are traveling and diseases can be spread quickly. and that we need to have an on-the-shelf playbook for the next time this happens. And again, it's not a question of if, it's a question of when. And we need to be a hell of a lot better prepared than we were this time. And that's for everyone. You know, that's not just the administration. That's the states, that's Congress, that's all of us need to be better prepared for this next time. And a couple things along those lines. I mean, we should know right now that if there's going to be, again, the next pandemic, we should know exactly what companies are going to be in charge of shifting their existing manufacturing processes to these processes, whether it's masks, whether it is gowns, whether it's ventilators, whether it is prescription drugs. I don't know, but we should have them lined up knowing that, hey, when this happens again, your job is to shift quickly from here to here when we tell you to do it. We also know that our supply chains have to dramatically be shifted from what we are currently doing. And what I just talked about, having the manufacturing capacity shift quickly, helps address that change in the supply chain. Because we have seen with this pandemic, if we have to rely on factories in other countries to give us what we need when they're trying to keep it for themselves, or other countries are fired as well, we're not going to be in a position to adequately provide health care that U.S. residents deserve.
You had mentioned testing. Can you give us an update, just numbers, kits, the availability of testing, and what the county's potential policies are for that? And related, we hear a lot about contact tracing, whether it's an app or some other effort to identify and make sure we understand who's been infected and their circle. So testing and contact tracing.
Yeah, from a macro standpoint, testing is important, but some ways that testing is important at the beginning of the pandemic. It allows you to quickly confine and isolate where it is breaking out, and hopefully literally prevent the spread of it elsewhere. And by having that testing, you're able to bring your assets to bear where they need to be. So imagine if you quickly knew that there was an outbreak occurring in New York City, as an example, and you were able to bring healthcare professionals, hospitals, PPE, and all of the required assets you need to isolate that outbreak any further, you've got a good chance of being where South Korea is right now. When it is expanded as far as it has across our country, it's difficult, in my opinion, for testing to play the same role. Now the testing is there more to help us do a couple things. One, understand additional hotspots that may begin to pop up that, again, will allow us to redeploy our medical assets to address that hotspot in hopes of slowing it down so that we don't overwhelm the local healthcare system. That's an important part. In addition, testing also helps us have a better understanding of how far we have been as a society infected by this disease. As I stated earlier, many experts will tell you 60–70% infection rate over a 24-month period. Some would suggest we're already at a 10% infected rate. We just don't know it because of all the asymptomatic individuals who had it and didn't know it and have never been tested. So it's important for that testing to help us understand just how lethal and widespread this disease is. Because if you look at the numbers, it would appear we're running about a 5% fatality rate on infections. But most experts would say when it's all said and done, you're probably looking at closer to 2 to 0.3% as the somewhere as a closer range to what we're going to end up having the evidence show us by the time we get through that 24-month period.
Got it. Thank you. We're starting to run.
I don't want to discount the fact that 2 or 0.3% is a big number, and it's about 10 times more lethal than the common the flu. But you're still talking hundreds of thousands of Americans over that time period. So, finding therapies and hopefully eventually a vaccine can obviously reduce that number dramatically.
Thank you. We're starting to run a little bit low on questions, and we're getting towards 15 minutes in the call. We're going to keep it to about an hour. So if anyone does have questions, please shoot them over. I'll throw a couple sort of micro ones out there, Harley. If you have any, do you have any insight into how, is the relief package, in Southern California, Orange County anyway, being distributed in some way that might positively impact, lower income areas that are more disproportionately impacted by the virus? Has that been any conversation?
In the existing legislation that's been passed, most of it's being pushed down through state and local governments. And we kind of talked about that earlier. In the upcoming legislation, yes, there's a lot of discussion. I think the biggest discussion is broadband. We have huge deficiencies in broadband in both rural America and urban America. And the good news is, because those demographics are both needing broadband, we're seeing bipartisan support across the aisle to hopefully extend it. And we're going to learn a lot of things from this pandemic, and that some of them are good. And I'll use two things I think are good coming out of this pandemic. One is, with broadband accessible to all, because it's the equivalent of today's electricity and running water, you are going to see more teleeducation take place. You're going to see an opportunity for more remote working as well. And you're also going to see more telemedicine. So these are things we all knew were coming, and that this would be a gradual shift in how we carry on our daily lives, whether we're in school, whether we're in business, or whether we're a doctor delivering medicine and advice. What we're seeing is a paradigm shift in the speed of the implementation of these changes due to the pandemic.
Absolutely. I'm sure our work lives, our work environments in office buildings and retail shops have been changed forever, especially.
Yeah, and another one too in that regard is climate change. I think everybody on right now, you just have to look outside and realize it's nice being able to see things you've never been able to see before, because the pollution is cut down. And for people who have grown up their entire life without seeing this reduction in CO2 in the air, I think it's kind of a wake up as to what we could have. Harder for the elimination of CO2 to a more manageable point.
That's certainly the topic of Foreign Affairs' latest issue, that the climate catastrophe is going to be the next one.
The one thing we're going to have to deal with, though, is I saw somebody send was a message from essential workers to non-essential workers, and the message from the essential workers to the non-essential workers said, now that you are preparing to come back to work, please note that the speed on the highways is now 95 miles per hour.
Right. We've all enjoyed that recently.
Yeah.
Well, thank you. I think we're kind of run out of I think questions to build on Harley's presence here today. I want to thank him for being here, and then I'm going to just briefly for a 30-second thank you from our Executive Director, Nora Valenzuela.
Good afternoon, Congressman. Thank you so much for joining us.
Thank you.
Really appreciate that. I'm the current chair of the World Affairs Council, and on behalf of the Board of Trustees and also Executive Board, I wish to thank you. As a nonpartisan organization, our primary focus is on public education without taking any political position. So since right now, the most important world affair is in fact COVID-19, what can we do as an organization to help you and other local elected officials to participate and be of help? What can we do to help from the membership perspective and also as our Board of Trustees?
Well, thank you. And thank you to your leadership and the board's leadership in continuing to strive to meet your mission in these areas. Keep doing what you're doing. I believe education, my wife and I have always been huge supporters of education, from foster children having access to college education to higher education, as well as making sure impoverished individuals, including the homeless, have access to education. I truly believe if you want to talk about the safety, security, and stability of our country, the first thing on the list has to be the best educated workforce in the world. And if we accomplish that by making sure all of our kids have equal opportunity to quality education, then we are long on our way to achieving those outcomes. And it doesn't, I talk about if you're able to get lower socioeconomic kids educated, let's just, for sake of discussion, I talked earlier about what does $40 billion buy you? It buys you half of the 18-year-olds in the country having a free college education. We know that the lowest quartile is the least represented in college. We also know commonsensically that if those kids had a college education, we know that there's a greater likelihood that a higher propensity of them will be in middle incomes and higher, which means they have less impact on needing social services. They're going to pay more taxes than what the college education costs them. They're breaking the cycle of poverty. They have more discretionary income, which lifts every single business out there. It should be an absolute no-brainer for all elected officials to make education a primary goal, if not the primary goal. So thank you for your leadership in this area, because we need more of it.
With that, I'd just like to thank you again, Harley, and the World Affairs Council staff and council for coordinating this. And perhaps we'll look forward to another one in a little better profile of the curve later on this year.
Hopefully in person.
Absolutely. Thank you.
At an evening event where you guys serve wine and I sound a lot smarter after you've been drinking for a while.
That's it.
All right. See you later. Thanks. Bye.
Bye.